Hello and welcome. Today we'll be talking about bipolar 1 and 2. Bipolar disorder, formerly known as manic depressive disorder, is a mental illness characterized by dramatic fluctuations in mood that shift between episodes of highs known as mania and hypomania, or extreme influxes of euphoria that can involve a loss of judgment and emotions of great happiness and lows known as depression, or overwhelming feelings of sadness and hopelessness.
Bipolar disorder often runs in families. Most research has suggested that this disorder is hereditary, where people with certain genes are more likely to develop bipolar disorder than others. Many genes are involved, and no one gene can cause the disorder. However, genes are not the only possible cause for bipolar disorder. Even if most do not develop this disorder, those who have immediate family who have the disorder are more likely to develop it. To be diagnosed with bipolar disorder, a healthcare provider may find signs as they complete a physical exam and order other medical testing to rule out illnesses. The next step would be to refer their patient to a mental health professional for further evaluation. The ultimate diagnosis of bipolar disorder is based on the severity and frequency of the patient's symptoms and experiences during their lifetime. Bipolar disorder has different conditions, primarily categorized as bipolar 1, BP1, and bipolar 2, BP2. BP1 involves periods of severe mania that can require medical attention, while BP2 is characterized by periods of hypomania, which is a less exhausting version of mania. These conditions also differ in depressive episodes. Bipolar 2 requires a major depressive episode for at least 2 weeks for diagnosis, and while those diagnosed with BP1 may experience depressive episodes, they are not a defining feature of the condition.
General symptoms of bipolar disorder are abnormal changes in emotions and behavior, including engaging in actions that have negative consequences without question. Specific symptoms are commonly associated with either depressive or manic episodes. During a depressive episode, individuals experience a multitude of symptoms, including irritability, persistent sadness, frequent crying, suicidal ideations, apathy towards hobbies they once enjoyed, fatigue, a lack of concentration, and a change in hygiene habits. Mania and hypomania are characterized by psychosis, hallucinations, abnormal increases in energy, and reckless behaviors. These symptoms are frequently pervasive, impacting the functions of daily life, feeling as if weight is continuously weighted on their shoulders. Additionally, manic and depressive episodes can occur simultaneously, producing a mixed episode. These symptoms provide a basis for diagnosis whereby mental health specialists consult the Diagnostic and Statistical Manual of Mental Disorders 5th edition, or better known as DSM-5, and perform an evaluation to eliminate the possibility of other 3 illnesses being the cause. The DSM-5 is the most current standardized classification of mental illnesses used in the United States by mental health professionals. Bipolar disorder is often diagnosed from the late teen years to early adulthood, typically manifesting around 25 years old. It is necessary to acknowledge these symptoms as soon as possible to provide proper treatment and minimize the damage done to an individual's life.
As mentioned above, bipolar disorder may co-occur with other mental disorders or conditions. These types of mental disorders or conditions may include anxiety disorders, attention deficit or hyperactivity disorders such as ADHD, misuse of drugs or alcohol, or even include eating disorders. According to the National Institute of Mental Health, when one is experiencing severe manic or depressive episodes, they may also show symptoms of psychosis, such as hallucinations or delusions. For example, someone having psychotic symptoms during a depressive episode may falsely believe that they are financially ruined, while someone having psychotic symptoms during a manic episode may falsely believe that they are famous or have special powers. It is important to look at symptoms over the entire course of the illness and the patient's family history. This will help in determining whether that person is diagnosed with bipolar disorder, among others that they might have.
The treatments associated with bipolar disorder are based on the severity of the forms of bipolar disorder. The main treatments will involve mental health professionals treating their patients with bipolar disorder with medications, psychotherapy, or the combination of different treatments to create an individualized and balanced treatment that is personalized to each patient. In terms of medication, there is a specific type of medication that helps to control the symptoms of bipolar disorder. Sometimes patients may have to go through a trial and error phase where they may need to try several different medications before finding the combination that will best benefit the patient and hold the best daily outcome for the long run. These medications are usually prescribed as mood stabilizers and antipsychotics. Even though it is common to treat bipolar disorder with antidepressant medication, it is important to also take mood stabilizers, as the antidepressant alone could trigger a main episode or a rapid cycling in the patient suffering from this disorder. Besides medication, psychotherapy is used as a form of treatment. Psychotherapy is a term for various treatment techniques that aim to help a person identify and change troubling emotions, thoughts, and behaviors.
Psychotherapy offers support, further knowledge, skills, and even strategies for those with bipolar disorder. In this form of therapy, families are often offered assistance in further understanding what their loved one is going through and how to help. This also aids both parties in having an outlet for their emotions that is beneficial for their mental health and the future of their relationship. This allows the medical professional to work hand in hand in monitoring the patient in their daily lives to see if there is progress or to make any necessary adjustments. Other treatment that is helpful in managing bipolar disorder are electroconvulsive therapy, ECT, transcranial magnetic stimulation, TMS, and light therapy. ECT is a brain stimulation procedure using electricity that can help relieve severe symptoms of bipolar disorder, used in cases that require rapid responses like suicide risk or catatonia. TMS is a brain stimulation that uses magnetic waves to relieve depression over a series of treatments. Finally, light therapy, an evidence-based treatment for seasonal depression, is commonly experienced by those with bipolar disorder. All the treatments mentioned are helpful to those with bipolar disorder, but are considered as a last resort after other resources have already been exhausted.
It is important to become knowledgeable if you or a loved one are experiencing behaviors strongly associated with bipolar disorder. Talk to your healthcare provider and discuss your concerns about anything you may feel to properly monitor your health. Be consistent with your treatment and do not be afraid to communicate any changes that may occur throughout your treatment. Take medication only as directed, as it will be difficult for your healthcare provider to provide the appropriate combination of treatments. Create a routine for eating, sleeping, and vigorous exercises such as jogging, swimming, bicycling, or what have you. This may help with depression and anxiety, promote better sleep, and improve health and brain function. Another way to help the process of the treatment is to keep a life chart to help recognize your mood swings. Most importantly, be patient with the process. As extensive as it may feel, nothing is fixed overnight. It takes time, patience, and most importantly, support, knowledge, and understanding within yourself.